Let's say a woman is 51, she's going through menopause, her quality of life is horrible because there are literally 22 symptoms of estrogen deficiency, not just one. There's hot flashes, night sweats, anxiety, mood swings, irritability, depression, joint pain, hair loss, dry vagina, skin changes, urinary incontinence, urinary tract infections, weight gain, loss of sex drive. I mean, it goes on and on. Most women have no idea that all of this is one thing. They are busy running to 15 different doctors thinking that each thing is separate. Well, guess what? You don't have 15 things. You have one thing. You have estrogen deficiency. It's like thyroid hormone deficiency. If you had that, you would have dry skin, you would have dry hair, you would have weight gain, you would be fatigued, you would have no energy. It's all one thing. That's how hormones work.
Good morning, everybody.
Good morning.
So nice to have you here. We have a special guest this morning, and I'm going to introduce her. She is Dr. Barbara Taylor. She's an obstetrician and gynecologist who retired from active practice in 2001. Despite having a law degree and a master's in business, her true passion has always been helping women. In 2008, she published the first edition of her book, Menopause Management Your Way, Now and for the Rest of Your Life. In 2016, she began delivering her unbiased, comprehensive education on on menopause on YouTube, where she has almost 100,000 followers. Dr. Taylor sees herself as a teacher and a tailor of women's health and menopause. And of course, this is her book, more than 600 pages.
Teacher and tailor, no pun intended, huh?
Teacher and tailor. It works.
It works.
It's true.
Oh, that's good. I like that.
So thank you. That's an introduction of Dr. Taylor. And so, Dr. Taylor, I was wondering, most of Dr. Montgomery's patients are of perimenopausal and menopausal age. And I'm wondering if you might speak, as long as you feel necessary, about the Women's Health Initiative study. That was the study that seemed to take all women, most women, off of hormone replacement therapy. It gave everyone, it seems, the impression that hormone replacement therapy causes cancer. I notice in your book that the healthy women studied, 50% of them were smokers, 33% were overweight, 33% had high blood pressure. Their median age was 63, older than when most women begin hormone replacement therapy, and that women with severe menopausal symptoms were excluded from the study. Mm-hmm. So that's sort of the one thing I was hoping we might discuss. Mm-hmm. And then in episode, Dr. Taylor has a YouTube channel, as I mentioned, with almost 100,000 followers, but from episode 1 to episode 300 and something, you're getting an education in menopause. And episode 292, timeframes for the development of diseases due to estrogen deficiency. We look at this graph here, and I'm wondering if you might speak to it, because I believe that in the plant-based community, somehow we think that we are immune to estrogen loss because of the way that we eat. And I wonder if you might speak to that. So heart attack, osteoporosis, and Alzheimer's.
Well, first of all, you need to think of estrogen as your fountain of youth. Estrogen is what keeps your body young on the inside and the outside while your body is producing it. So when we go through menopause, what happens is we lose our fountain of youth. And so what happens is we start aging on both the inside and the outside. And it just so happens that the aging process on the inside of our bodies entails three things. Our heart arteries go from being soft and supple like this to getting stiffer to becoming hard, which is where we get the term hardening of the arteries. That's the aging process of our heart, most of which was prevented by estrogen. Our bones go from being dense to being osteoporotic. That's the aging process of our bones. And our brains are covered with estrogen receptors that are fuel for our brain. They make our brain function beautifully. And the aging process for our brain is shrinkage, which is Alzheimer's, because the estrogen receptors are empty. So it's like your brain is running on fumes. So when it came to the WHI, the main focus of the WHI was heart attack. And the key question with the WHI was, can HRT prevent heart attacks? Not does it cause heart attacks, can it prevent heart attacks? And then they tacked on a bunch of other things, just other things to look at besides heart attack, but they designed the study for a heart attack. Well, the problem is they used women who were on average age 63. Well, if these women, if the average age of menopause is 51.2, if all these women had gone for 10 or more years with no estrogen, that means that they were already on the road to hardening of the arteries. Mm-hmm. So the aging process had already begun. And then they gave them estrogen and they said, well, can it prevent a heart attack? Well, when these women went on to have the diseases that they would have with aging because they lost their fountain of youth, they blamed it on the hormones. So an analogy would be, if you took a bunch of insulin-dependent diabetics and they took their insulin, but they also still ended up having some go blind and some have renal failure and some have amputated limbs, would they blame it on the insulin? This is how you have to understand what this study did, but they didn't keep their focus on prevention. Instead of reporting the results to women in terms of, no, HRT won't prevent a heart attack if you're already at risk for heart disease, if you've already developed hardening of your arteries. Instead, they said, oh no, it causes a heart attack. They're two different things. And they require two different study designs, and they're done in two completely different ways, but they switched gears in the study and told you something that they hadn't studied. That is the big prevailing problem of the whole study. And they did it with everything. They then went on to say, well, it causes Alzheimer's. But it was like, no. These women were already going to get these things. They already had the beginnings of the diseases. The HRT just couldn't stop it or prevent it or turn it around. And we already knew that. It's not, HRT doesn't fix these things, it just prevents them. There's a big difference.
The study, Premarin and Prempro, correct?
Premarin and Provera. Provera is methoxyprogesterone acetate. So it's a form of progesterone.
And both of those do both come from a horse?
No, Premarin is a brand name.
Yes.
Premarin is pregnant mare urine, Premarin. It is the only estrogen product that has anything to do with mares. It is the first estrogen product ever produced back in the 1940s. And it is estrogen only. It is conjugated estrogens, meaning all of the estrogen in a horse. A horse has over 11 kinds of estrogen. We females have only 3. But Premarin contains all the ones that we have, plus some from a horse, but it's one single product. That was the first estrogen ever developed, and they did the study only using that estrogen, but now we have many others, and they haven't done any studies like this. The big thing about the WHI is that it was the most expensive study ever done. It was a $1 billion study. Which is why everyone treated it like the Bible. But no, they broke all the rules of science. They manipulated the data. I know all the people who did it. They broke all the rules, and still they got away with it because it was such a big study. Well, Premarin isn't used very much anymore. I mean, there's nothing wrong with it. Look, I tell people there's no right, wrong, better, worse, good, bad, or best. Those are marketing words. Women are not robots. We should all do whatever's right for us individually and don't worry about what everyone else is doing. But nowadays, everyone's got something to say and an opinion and a reason to put something down. It's like, your body's opinion is the only one that's going to matter. Either you're going to do what your body wants or you're going to be very unhappy. It doesn't matter whether you like it or not. Your body doesn't care what you think or what you read or what you heard or what you prefer or what you believe in. Your body just doesn't care. It's like expecting my hair to care if I heard about straight hair being better and finding thousands of studies to prove it. My hair doesn't care. So this is the same way it is for your body. So Premarin, some women do great on Premarin. Some women love it. For 50, 60 years, it was the only hormone out there. You meet a woman who was taking Premarin, she's 100 years old and she's as snappy as she can be because they took estrogen replacement. And it doesn't matter whether it comes from a horse or a plant or this or that. It really doesn't matter. It's a matter of how does your body use it and respond to it. Progesterone comes in many, 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 many different forms too. Medroxyprogesterone acetate was one of the very first, and it is, and I don't like this. I don't like these words. I don't like the words synthetic and natural. I don't like those words because they're very misused. Okay, people think of natural as better. It's not better. It's whatever your body wants. Some people do much better on a synthetic than a natural product. It just doesn't matter what the label is. But medroxyprogesterone acetate is not one of the most used progesterones anymore either. So now you have this big study done with hormones that hardly anyone uses that much anymore. And everyone's still using the study as if it's dogma. So that's a problem too. You mentioned something earlier, Jackie, about the plant-based community and how the plant-based community says, yes, but if I'm a plant-based person, I have a 100% plant-based diet, I don't need to worry about this estrogen loss and estrogen deficiency matter. Well, two things of importance here. Number one, when you lose your fountain of youth, that aging process begins. And you saw on that graph that you showed on the screen that it just gradually increases. The risks for all three of these diseases just gradually increase with time. The problem with adopting the mentality that I'm plant-based and therefore I don't need to worry about menopause, which is estrogen deficiency, is that that is a huge, huge oversight of the fact that nutrition is nutrition, exercise is exercise, and a hormone is a hormone. They will never do each other's jobs. You cannot get your exercise from your food. You cannot get your food from your exercise, and you cannot get any of those things without a hormone. A hormone will only do the hormone's job. Food and exercise will never be a hormone. Does an insulin-dependent diabetic say, "Oh, I'm gonna manage my insulin with my food and exercise"? No. Okay. Every hormone deficiency on planet Earth, every hormone was produced by your body for a reason, meaning your body can't live without it. And every hormone deficiency on planet Earth produces a long list of symptoms that tell you something is missing. You feel horrible. And if you don't replace the hormone, there are fatal diseases that ensue over time, period. It doesn't matter what the hormone is. With thyroid hormone deficiency, if you don't replace it, there are fatal diseases. With insulin deficiency, there are the basic science of hormone deficiencies is the same no matter what the name of the hormone. And so when you start adopting these rules that are magical thinking, you will get into trouble. So it's great to have a 100% plant-based diet, and it definitely is the diet that is absolutely best for your heart and will help you decrease the risk for heart attack no matter what your situation. But it's not going to take the place of estrogen. Any hormone, estrogen, progesterone, testosterone, any hormone that has to go through your digestive tract in order to get into your bloodstream has to transfer through your liver. In the liver, there's a slightly increased risk of blood clots. That is the only issue at hand here, a slightly increased risk of blood clots. Now, what's the biggest risk in the world for a blood clot?
Well, inflammation, a sedentary lifestyle, inflammation, etc.
The biggest risk in the world for a blood clot is pregnancy. How many women worry about a blood clot then? None. Okay, women worry about all the wrong things at the wrong times. Okay, pregnancy is the biggest risk in the world for a blood clot. The second biggest risk is a genetic mutation for a blood clot. The third biggest risk is a previous blood clot. The fourth biggest risk is morbid obesity. The fifth is immobility. The sixth is smoking. For most women, addressing menopause management at about the age of 50 a blood clot doesn't amount to a hill of beans for them personally. But when they say, oh, but I've heard about a blood clot, I'm like, well, but are you going to make your decisions around something you heard? Or are you going to apply it to yourself and decide whether or not it warrants any consideration? And most women don't need to be weighing a blood clot hardly at all, unless you've had some of the risk factors that are pertinent. But this is where the tailoring comes in. If you're worried about stuff that doesn't apply to you, you're going to fail. So tailoring is everything. If you don't tailor everything to you specifically, you're doomed. I teach my students, I say, you've learned all this logic from me and you've learned about these diseases. You can't go into your doctor and say, I want HRT to prevent a heart attack, osteoporosis, and Alzheimer's. They will slam the door in your face because they have guidelines that say the only reason you can give HRT is severe symptoms of menopause. So I tell them, if you want HRT, you're going to have to go in and say, oh my God, my vagina's on fire and I can't sleep and my husband hates me and I'm going to lose my job. Okay, show them severe symptoms of menopause. That is the only way you're going to get this stuff. And they're always going, oh my God. And I say, you have to play a game. I say, it's not fair. It's not logical. But because of the craziness that ensued from the WHI, that is what you have to do.
It's an excellent topic. I mean, you put things in perspective so well. And I think that's really the most important thing that I've learned as I've matured in my clinical practice is to always step back and put things in perspective. And I think as healthcare advisors or people who are getting advice, you should always step back and put things in perspective because that helps you, line up the dots appropriately. So I really love the way you do that. And so this has been very enjoyable. We really hope to have you back. There are a lot of things that are in your, I mean, someone wrote that book is humongous. So I'm sure there's a lot we didn't cover. So anyway, so one of these days, but no, I really learned a lot. And actually, I mean, it's influenced my practice. I get a number of women because we do practice a little bit outside of cardiology and wellness. And we get these questions. And so, I'll be less hesitant to prescribe hormone therapy or recommend it to patients because of what I've learned today. So I think I really thank you for that. This has been fantastic.
Well, thank you for having me.
Great. No, this is wonderful.
Thank you so very much, Dr. Taylor.
Well, thank you.
I have a quick question. I have a quick question. I'm sorry that I didn't think to ask it, but I'm 70 years old. I'm still having hot flashes. Is that normal?
Oh, some women have them for the rest of their lives.
Okay. Thank you.
All right.
Great.
Good final question.
All righty. Thank you, everybody.
Y'all have a great day. Have a great
Thank you.
Thank you, guys.
Bye.